Okay, so a lot of people ask me, as an LPN, what do I do on med-surg? And so I'm gonna just tell you exactly what I do. So at the hospital I work at, we do team nursing. So there is a team of nurses. There is an RN and an LPN and a PCT. So the RN and the LPN and the PCT is given 10 patients. The RN delegates the 5 patients that is appropriate for the LPN to have on their own. Because in acute care, the LPN has to be under an RN. So that's why they delegate the 5 patients. For the most part, all of the patients really that we get, we can care for. Like if the patient is on an heparin drip, it's more appropriate for the RN to have that patient because we can't initiate the heparin, but we can be the second nurse to sign off on the heparin. If we know that a patient's hemoglobin is less than 7 and they're going to get some blood, it's more appropriate for the RN to have that patient because LPNs cannot initiate blood, though we can monitor after the first 15 minutes. So we do everything that the RN does. The only thing that we cannot do is initiate blood, but we can be the second nurse to sign off and we can monitor after the initial 15 minutes. And then we cannot do the initial assessment. So when a new patient comes to the floor, we can do their admission, but we cannot do the initial assessment. So we can ask all the questions, ask them if they have advanced directives, ask them what they're in the hospital for, ask them about their history. We can do all of that, but as far as the initial head-to-toe assessment, the RN has to do the initial, but we can do the shift assessments after the initial assessment. We can do IV push meds. We push every IV push med. We push IV antibiotics, IV pain meds. The only IV medication that we cannot push at this facility is cardiac meds, so like hydralazine, metoprolol, stuff like that. But we can give Lasix, protonics, antibiotics, all the other stuff we can give IV push. We do all the hanging. We can hang electrolytes like potassium, magnesium, fluids, antibiotics, all of that stuff. So honestly, we really can do a lot of stuff in the hospital, which is why I came to the hospital, because I can utilize and use my skills to the full advantage and work within my scope of practice at its full capacity. Because working in long-term care, you're not really starting IVs. Like we start IVs here. You're not starting IVs at nursing homes really. You're not really given IV antibiotics. It's very rare that you do. You're just really like passing just oral meds and giving insulin and stuff like that. But in the hospital, it's so much more that you can do, and that's why I came to the hospital to get that experience. And I have been on this med-surg floor almost 2 years. So yeah, that's pretty much it. My 5 patients that's delegated to me, I give report to whatever nurse, whether it's an RN or LPN, I give report on those patients. We do everything. Contact the doctor if we need orders. We send the patients down for their procedures, give report to the dialysis nurse when the patient is going to dialysis, give report to the nurse who, if the patient is having a procedure done. So I hope that answers everybody's questions about what I do. Now, other facilities may be different in different states, but in Tennessee, that is what we can do, pretty much everything in the acute care setting. Now, in the nursing home, I know there has been a lot of controversy, but in the nursing home, the LPNs can do the initial assessment. The LPNs are the charge nurses in the nursing homes here that I have worked at. We do have to have an RN in the building, and most times it's our unit manager that is the RN or the supervisor. But a lot of times, they're not even nowhere to be found on the floor. They're like somewhere in the office or whatever. So you're more independent in a long-term care facility. But you're not getting able to utilize those skills that you can use. Like if you look up what LPNs can do, it's so much we can do. And so I'm thankful that I was able to get into the hospital, because at one point this hospital was not hiring LPNs. They came in, they had a shortage of nurses, and still have a shortage of nurses, and so they realized, like, okay, the LPNs can do a lot. We can bring them in and utilize them. And so yeah, I love my job. I love what I do. I love my patients. I like med surg, but this is not my final destination. I am in RN school to get my RN so that I can work NICU, because that is my passion. That is what I want to do. I want to work with the little babies. So yeah, I hope this answered all of you guys' questions. I get the question all the time, like, well, what can LPNs do in a hospital? So hope that clears it up.